This week's news from Florida has been more disturbing than usual. First, Governor Ron DeSantis announced he was appointing Dr. Joseph Ladapo as new Surgeon General and Secretary of the state's health department. Ladapo is a controversial choice for that role, being a cardiovascular specialist without training in epidemiology, virology, nor infectious diseases. He was also a signatory to the Great Barrington Declaration, which promotes herd immunity and normalization of activities as the solution to the COVID pandemic. Why not for polio and smallpox, too? Ladapo promptly stated he would reject fear as a way of making policies in public health. He has argued against many public health measures, including lockdowns, and has argued for allowing individuals and parents to decide, for example, to make their own decision as to whether to quarantine. With that as a prelude, Manny Diaz, the Republican chair of Senate Health Policy Committee and the vice chair of the Appropriations Subcommittee on Education, someone who opposes mask mandates and has not gotten a COVID-19 vaccine, jumped into the fray. On Thursday, 9/23, he announced that he also wants to review vaccine requirements for childhood illnesses like measles and mumps. Students in Florida are currently required to have proof of vaccination for diphtheria, tetanus, acellular pertussis, inactivated polio vaccine, measles, mumps, rubella, varicella/chickenpox, Haemophilus influenza type B, pneumococcal conjugate, and hepatitis B. There is an allowance for religious sin. The commentary on Twitter was swift and scathing. Democrat Representative Carlos G. Smith said, "In Florida, Governor DeSantis and the GOP have put QAnon anti-vaxxers in the driver's seat. They're now in charge of state policy, God help us all." Attorney Aaron Parnas opined, "Just when you thought the state of affairs in Florida could not get any worse." Infectious diseases expert and executive associate dean for Emory at Grady Dr. Carlos Del Rio pondered, "Makes you wonder what Pro.